Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine. I want to thank you so much for taking a look at this video. I'm excited today. We're meeting with Dr. Richard Hiler, and what's great about this is he's going to be talking about stem cell. And as we know, there's a huge buzz going on with stem cell, people getting healed, and people getting out of pain. So what I'd like for everybody to do is share this video. Make sure you put it out there, because we all know that when you're sharing a video, whether you have that pain or not, knowing that you're going to be able to help other people. So please share this. If you have any questions, you can put it right below the this live stream, and you know, I'm sure that we can help assist you with that. Also, before I present Dr. Richard, let me tell you a little bit about who Dr. Richard is. Dr. Richard is a doctor of chiropractic. He founded Hiler Chiropractic Neurology in 1998. He is also a board certified functional neurologist, and he is also a board certified, if I can say this correctly, electrodiagnostic studies, and also certified by American Board of Vestibular Rehabilitation, and also certified functional neuroorthopedic rehabilitation. He's also the co-founder of Feel Amazing Institute in 2015, which is a medical corporation. And the great news, back in 2016, Dr. Richard partnered with Stem Cell Institute of America. So thank you so much, Dr. Richard, for being on this live stream.
All right, it's going to be fun.
All right. So, you know, what I love about this, doctor, is that we have a lot of doctors that come on the show, and I never hear the same thing, you know, once or twice or three times. It seems like it's always fresh from you doctors, because you guys are staying on the cutting edge. And one of the questions I really wanted to ask was, how did you get started in stem cell therapy and regenerative medicine?
Well, basically, it was out of necessity. Being a chiropractor for, at that time, 10 years. I'm bending over all day. College football screwed up my back, lifting weights, and I had developed a debilitating problem myself, where I was wondering what I was going to do with my life, because I was suffering so bad. Chiropractic wasn't helping. In fact, it was to the point where it actually hurt. Physical therapy was not helping. I already knew what cortisone would do to me, you know, long term, so I didn't want to go there. And being only 35 years old, I didn't want surgery. So I suffered. I struggled for about 15 years until I came across a friend of mine who was just like me. He was a chiropractic neurologist. He works out of Sarasota. He came to Naples because actually there was nobody in Naples offering this 4 years ago. So he came to Naples to do a seminar trying to recruit, you know, patients, and actually trying to teach doctors as well. And I said after his seminar that, you know, if this is something that could help me, it was going to basically change the whole direction of my practice, because if it could help me, I could help many people that I continued to see struggle even with the chiropractic. So that's what got me involved. And, you know, it's a long story on how it helped me. I actually did stem cell therapy twice. And the first time, my pain every single morning was about an 8. I'd wake up crooked. I'd have to stretch out for an hour and a half before coming to work. Many times I'd be working on patients. I'd end up on the floor and I couldn't move. And of course, I'd have to cancel all my patients for the rest of the day, and hopefully in a couple of days I'd get back to work. It was just miserable. I gave up everything I enjoyed: my golf, my weightlifting. I was getting terribly unhealthy. I couldn't exercise. Couldn't run on the beach with my wife, and I was pretty miserable. And I really can feel where my patients are coming from when they are just, you know, frustrated and just really struggling to enjoy their life.
You know, what I love about this is that I see a lot of doctors that come online and they're promoting stem cell, but they never really have a really strong sense or a story to explain why they're doing it, you know, as in, you know, maybe they're helping their family out or friend. What I love here is that you tried it on yourself.
I am so happy I struggled because I could not use, I could not have the confidence in telling somebody that this could really help them if I didn't experience that for myself.
How long did that take, the healing process, for you?
Oh,
I know everybody's different.
I did it twice, and you know, regenerative medicine gets better all the time. So, 4 years ago, I actually used an inferior product, and one of the neurosurgeons in town who did my back, he actually said what most medical doctors would say. He said, "Well, I don't know anything about it. I don't know if it'll work, but you know, he was kind of a colleague friend, and he said, you know, I'm happy to give it a try, and we'll see how it works for you." But when he injected the facets in my back with it was actually placental tissue at that time, then the first week my pain went from an 8 to a 6. The second week was like a 5. And basically after about 8 weeks, it had settled in at about a 3, which to me was miraculous, from 8 to 3 in 8 weeks. And I still had some aches and pains, but I could fully function. I could get back into the gym and I can, you know, kind of work on my own health again. And then 2 years later, some better products came out, and I said, you know what, I'm going to try this again. This time not with the neurosurgeon, but with my own nurse practitioner. She injected my facets again. My pain went to a 0, and it's been at 0 now for over 2 years. Not one day of any pain.
Wow. Did you notice that it helped you in any other areas besides where you had the pain at that time? Did you notice anything like a little bit later?
Well, you know, I wasn't drained because I was always hurting, so of course I had more energy, you know, just a better outlook on life. But no, my condition was mainly back. You know, since I've done my knees as well. But no, it basically was all for my back, and that's really where I got the results.
Okay. So one would ask, how does basically the stem cell therapy work?
Well, when you think about it, everybody realized that life starts with two cells. You have the sperm and the egg. And when they come together, they form one cell. And that one cell is a stem cell. That one stem cell will divide, and it will continue to divide, and it will become specialized and start to form all the organ systems of our body. So it all starts with a stem cell, and that stem cell divides and it grows tissue. And we will continue to grow till we're about 20. And at that point, our stem cells become somewhat depleted in some growth factors, but they still lay dormant in our fat cells and our bone cells. And at a time of injury, those stem cells are released and they go to the area of injury, and they help, you know, they release growth factors and they help heal the injuries. As we get older, our own stem cells, they get tired, actually. So they don't work as well as they once did when we were younger. And what we do is we actually use an allograft tissue that contains stem cells, and we inject that into the area, and it basically makes that area of your body heal like you did when you were younger. So the stem cells, you know, they release growth factors, they attach to the injured areas and the blood vessels in that area. And over time, it just gives the body an incredible boost so that it can heal like it did when you were a kid again.
I could use some of that. So I hear this a lot from a lot of people, you know, why don't I just do cortisone, or why don't I just go get surgery on my knee? I mean, what would you say to somebody like that?
Well, you know, I hear that all the time. Hey, doc, I just want to get fixed. I'm going to go have surgery. But what they don't realize, especially with back surgery, it's only about 50% successful. So it's like flipping a coin. And then many times they're getting a second and third and fourth surgery. Tiger Woods is a good example. You know, he had surgery in 2014 on his back, and then again in 15, and then in 16. In 17, he says, I'm never golfing again. You know, he had other issues, but so he's never golfing again. Basically, his back, he couldn't function anymore. He had one last surgery, and now you know, of course, he won another major championship. But
Wow.
there's no guarantees with surgery. I think hips are the best, maybe 90% are successful. With knees, it's more like 80%. Interestingly, there's some orthopedic surgeons in town that do knee replacement, and they add stem cells to their the knee replacement surgery so that people can heal from the surgery. And that surgeon is probably 98% successful instead of others who don't use stem cells. They might have an 80% success rate with their knees. And then there's risks. You have scar tissue, you have infections. One driving force with me, I do a ton of lectures around town because what happened in my family is my uncle at 69 years old, he went in for a knee replacement. I was just getting into this at that time, so being kind of unsure of the regenerative medicine at that time, I really kept my mouth shut. I wish I could have said, hey, try this first. But he had the knee replacement, and 3 days later, he died of a blood clot. And that is actually 1 out of 400 people will die within 30 days of a knee replacement, and blood clot is the reason why. On top of that, my own mother, she was bone on bone in her knee, and we tried stem cells. And when it's bone on bone, it's a tough situation. Plus, she had major alignment issues in her knee, kind of a bow-legged type situation. So you can imagine the fear she had when her brother went through this. He had his blood clot, and she went in for her knee replacement, and lo and behold, she had a heart attack during the knee replacement. She's still living. They had the next day they had to do a triple bypass, but this just what I try to tell people. Yeah, surgery may be your only option, but you really should, especially if it's not bone on bone, you really should try everything else first, and that would be the last resort.
Wow, it's amazing because whenever I talk with people, I mean, I'm not a doctor, so I just give my an opinion. As I always tell people, you got to look at the pros and the cons. If you spend money on knee surgery, you're spending between 60 to 100,000 plus, depending on what it is. And so, I mean, I look at just the cost of it. It's a no-brainer. It's like, knee surgery, you're paying lobster, getting stem cell therapy, very affordable. And I get this also a lot is, do any insurances cover normally stem cell? Do some, or it's not there yet?
And that's the tough part because they'll oftentimes cover cortisone. They'll cover the lubricants that people inject from it's hyaluronic or hyaluronic acid molecules. Which honestly, we do it here because insurance covers it, but I don't see it work too often. Insurance covers things that really don't work. Cortisone actually tears down your body even quicker.
Oh wow.
Yeah, it can get you out of pain, but if you're getting cortisone, you're basically giving up and say, get me out of pain now, I'll take that joint replacement later, because it does accelerate the arthritic process and the breakdown of tissue.
Wow, so it's basically, is it kind of creating more scar tissue, are you saying?
Cortisone, as a matter of fact, I had cortisone when I didn't know better in a muscle. And not only did it not heal the muscle, but it actually made a pit, like a dent in the muscle. It actually ate into my muscle. But anyway, your question was about insurance. No, it's not covered under insurance. But the cost of the therapy is not a cost, it's an investment, and it pays you back many, many times over. And it could be financed. We do offer financing for it.
Well, see, I love the word that you used right there, and a lot of people don't see that, investment. If I knew that I wasn't able to play with, I'm not there yet, grandchildren, I'm 43, but if I knew I wasn't able to play with my grandchildren and to maybe go dancing with my wife, that might seem like a little thing, but as you get older, you look at things a lot differently. That's an investment for your future, to have a better life with your mate, your family. And I wish more people looked at that like that instead of, oh, it's this much money. It's like, if you knew what you spent on junk food.
They have no problem spending it on a car, but they've only got one body and one life. So
no, exactly.
Where's your priority?
And they're not getting the cheap car. They're getting, I want a fully leather. What would you say would be the average that you're seeing in your office right now that people are are getting better with? Would it be months, 3 months, 5 months, 8 months? An average that you're seeing? Everyone's different.
One thing that happens immediately when we do an allograft tissue containing stem cells, when we do an injection, is immediately you're going to have less inflammation. So some people feel immediate within a day or two some lessening of their pain. As a matter of fact, not only does it reduce inflammation, it can actually convert inflammation into anti-inflammation. And that cascade of events of less inflammation is many months long lasting. So some people feel a little difference right away, but on average, it's about 6 weeks until it's real significant. The inflammation, the anti-inflammation is days, and then within weeks, you're starting, those stem cells, they actually have a honing device. So wherever the damage is, where the inflammation is they locate and attach to that, and then they start releasing their growth factors, and then it's a cumulative process day after day after day. And it does take several weeks many times to notice any change at all. The second time I did stem cells, when my pain went from a 3 to a 0, I didn't feel any different for 22 days. So I was like, even knowing what I know, I was patient. I'm like, that didn't do one bit of good. And then I woke up in the 22nd day with no pain. I thought it was a fluke, but never had pain for one day since then for over 2 years now.
So what I hear what you're saying is, correct me if I'm wrong. So let's say I had, I had elbow pain. Really, it was hurting really bad. But at the same time, my wrist is hurting. Are you saying that, because I heard what you said, that is it goes after the pain where it's in the body. So if I were to get my elbow worked on, would it also integrate where other pain is in the body and start to heal it, or am I seeing it incorrectly?
No, what we would normally do in that situation is we would divide the dose between the elbow and the wrist, or sometimes we'd have to use a double dose. The stem cells will actually kind of set up a matrix in that area and stick to, there's other things in there, growth factors and fibrin. And so it'll kind of grow a network of fibers in that area and kind of stay in that area. There are other products that actually go in the bloodstream and go everywhere, but the type of stem cells we do know, we put it right around the muscles or right into the joints, and they pretty much stay right there. Most people have so much damage there, they're going to stay right there. The knees that I see and the backs that I see, the stem cells are going to kind of stay there because there is so much damage.
Okay. Now, there's an old saying, not all doctors are equal. And where I'm going with that, would you say all stem cells are equal? Because I've heard of stories of people trying stem cells and it didn't work for me and stuff like that. Is there a such thing as a high grade stem cell and also maybe just a low grade? I don't know if I'm even saying it correctly.
Yeah, I think so. And the reason why I say when I first started this, I was using inferior products and I was struggling. So I would go to seminars and I talked to other doctors and they're like, I don't know if it was true or not. They're like, oh yeah, I haven't had one unsuccessful treatment yet. I'm just like, what the heck are you using? Because I'm not getting those results.
Right.
There was a learning curve. So I changed products like 8 times. And so the product I use now, I'm confident that for what it cost me, it's the best product out there. And there might be a product that costs twice as much that might be slightly higher, but for what our stem cells cost me, and if I need to get extra stem cells, I think our product is top of the line for sure.
So if I were to go to your office, I'm sure you've had people ask you, where do these stem cells come from? Because I know there's been a lot of misinformation online about where they come from. Yeah.
Well, there's the 2 ways I said in the beginning that we store our own stem cells in our fat and in our bone marrow, so they can be harvested from our own body. Mm-hmm. However, recently there's been problems with the FDA agreeing that we can use our own body fat anymore. They call it that we have to add an enzyme called collagenase to separate the stem cells from the adipose tissue. And they say you're manipulating it too much, and they don't like that. So there's many adipose-derived stem cell clinics that have been shut down. The other way is from your own bone. The problem is the bone stem cells tend to age as much as you age. And because they're missing some growth factors and they're missing some potency, they kind of lose their steam after so many years. Then sometimes it has to be done more than once. It doesn't work out so well. So what we use is what I mentioned is an allograft. And that's a tissue that comes from an umbilical cord from a consenting mother and a healthy baby. Some people, they think there's, abortions or whatever going on, but it has nothing to do with the baby. It's an umbilical cord, which in the old days was discarded. Now the mother donates the umbilical cord to the hospital. Everything is screened. The FDA actually goes into the labs where these stem cells are stored and make sure there's no antigens or nothing that is going to cause reaction with these types of stem cells. So everything's very safe, but it comes from day 0 or day 1 stem cells, which have a very high potency, a very high viability. They want to grow tissue. They basically grew a baby for the last 9 months. And now these stem cells can be used for everybody else to help heal their joints. And that's what we use is the allograft, which comes from a tissue bank. They're all members of the American Association of Tissue Banks. Actually, we have one lab right here in my hometown where we do sometimes order from. And it's inspected by the FDA. Everything's FDA cleared for safety. But because it's not a drug or a device, it's not FDA approved.
Right.
It is cleared for safety.
So if I were to come into your office and get a procedure done, how would that look like?
Okay, well, we treat a lot of things. So we're going to say...
We'll just say knee on knee, or I don't know. Bone on bone.
Knee is super simple. It's easy to get into. We actually use a camera in our office to locate the joint space and see exactly where we're going with the injection. But after we prepare the product, position in front of the camera, it's literally in and out. I mean, probably a 10-second procedure. There's no anesthesia. All we use is a little cold spray on the skin and maybe an ice pack for, we kind of flash freeze it. We put an ice pack right on that skin for 30 to 60 seconds and barely feel anything when the needle goes in. It's just getting through the skin, which is now numb, and then into empty space. So it doesn't hurt. Shoulders are much the same way. However, with shoulders, and this is, kind of a tricky thing. There's actually, I believe, 13 muscles that cross the shoulder. Mm-hmm. And one of those muscles may be a source of the problem. So it's not always in the joint. So we have to investigate and see exactly what would be the best location for these stem cells. The allograft, I'm used to saying stem cells for simplicity, but sometimes it's complicated. We like with backs, how many joints are in the back? There's a lot. For each level there you have 4 facets, one above and one below the joint on right and left, and then the disc. So we have to investigate exactly where should these stem cells go. So if somebody comes with a shoulder problem, it just doesn't go into the joint, which some clinics may do. They just put it right into the joint and they may have missed something. So we have to investigate, is it a muscle? Is it a bursa? Is it a tendon? Is it in the joint? How do we get the best result possible with each person? So to answer your question, knees are usually 1 or 2 places. Sometimes it's in the joint and under the kneecap. There is a muscle insertion. We have to check that as well. Shoulders, it's usually in and out and maybe 1 or 2 muscles. With backs, and we also treat peripheral neuropathy. With neuropathy, it may be 3 injections on one leg around 3 different nerves and 3 injections on the other. So that's 6. And then in the back, we can do up to 6 areas as well. So what we have to do is use either a double dose and sometimes even a triple dose and divide it between those areas. And we don't charge 3 times as much. We just charge a little bit more to get enough product in there.
Well, so is there a lot of downtime? Like I got to go take work off for a couple weeks and relax?
There's absolutely the one golden rule is nothing strenuous for at least 2 weeks, maybe up to a month. So in our town, I don't know if there's another town around that has as many golf courses as we do, but we say no golf for 30 days.
Okay.
No tennis for 30 days, no strenuous weightlifting for 30 days. You can do all your daily activities. You can work around the house. You can go to the store. People walk in and they walk out. There's no real restrictions. And we always follow up, and we'll give them some light exercises to do for those 30 days. But no, there's no real downtime. There's no, wraps, splints, braces, crutches, nothing like that.
Wow. Okay. So the thing that I hear a lot is, what are the risks? I mean, there's got to be a risk somewhere. Are there any risks that you see or you have seen, or are there any?
Well, some people think, well, don't you have to like check blood type, something like that? But no, these stem cells, they're blanks. They don't have any antigens that your body will reject. It's not like getting a kidney transplant. You have to suppress your own immune system. So there's no rejection risk. And really, there's no injury risk, except, anytime you pierce the skin, even if you're getting a flu shot,
right,
that little injection site could get infected. That's why we always follow up. We get people back a couple of days, 2 to 5 days later. Yeah, it might be a little red and sore, but we've never had that. But anytime you pierce the skin, it could be sore, it could be red, small chance of infection. Of course, if you have a clean facility, you're going to have very little infection. But we never had a problem, and no, there's no injuries that come from it. I think I've heard there's been more than 4 million of these procedures done with never one serious adverse event.
Wow. It's interesting because online, Google and stuff like that, which is sad to say, I notice there's a lot of misinformation out there, and there's so many people that I talk to just in person, saying, do your research, talk to people that it's actually worked on, not somewhere where it's more reputable.
Right. Anybody can write anything on Google.
Exactly. And then people believe it.
But yeah, I hear that a lot. So I just tell them, well, what did you hear? And then I try to straighten them out. Because, there's a few cases where doctors were doing some things that they shouldn't have been doing, and there was an adverse event. But when you follow the FDA guidelines and on what you're supposed to do, no, there's really none of that happening.
So I know that, you do the chiropractic side, and of course stem cell, and of course neuropathy, kind of like the triunity, kind of all in one. How would you say that chiropractic is, how, I think the better way would be to say that is, are you using any of the chiropractic techniques with what you're doing, combining with stem cell therapy?
Yeah, absolutely. You got to wonder, well, how this situation happened to begin with. And it was a mechanical issue that just got out of control, and then too much wear and tear, and became something the body cannot tolerate anymore. So isn't it a good idea to work with the mechanics, correct the mechanics, and boost the healing with the stem cells? Right. So not only are you getting a healing like when you were a kid, but you are fixing the mechanics that caused the problem to begin with. And not even necessarily fixing, but improving for sure. All those 13 muscles that cross the shoulder, well, they have to pull in the right, in the right fashion, in the right timing, with the right balance. If they don't, you're going to have impingement and wear and tear and pain. So we work with the mechanics, and then the stem cells boost the injury that's already there.
Okay, that makes sense. So about how many years would you say that we're in with stem cells before it actually reaching its peak? Because I kind of feel like it's just barely breaking ice. Would you say that too, or?
Probably so. Unbelievable. 4 years ago, there was nobody in my town doing this. And now, if I pull the Sunday's newspaper, there may be 8 half-page ads of different people doing it, orthopedic surgeons included. But it's a long way from, right now it's still a natural procedure, but I think there's a lot of research going on how can the pharmaceutical company actually attach drugs to the stem cells, because the stem cells know where to go. So
Right.
now they can actually deliver drugs right into the area if they want to. So I think that's coming down the road, but I think it's best right now that it's a natural procedure because every drug has a side effect, right? So, I think the possibilities are endless.
Mhm.
Right now, only 17% of the research is for joints, which is what we're really focusing on here. And 83% is for other things like diabetes and dementia and autism and spinal cord injuries. So it's going to go a long way. And the potential is almost, every chronic disease could probably benefit from a stem cell type of therapy in the future.
Well, here's more of a personal question for me would be, why would somebody like me, say I'm living in your area, why would somebody like me would choose your office rather than maybe choosing an orthopedic surgeon?
That's a great question because, hey, I'm a chiropractor. Why would you choose the chiropractor? First of all, I don't do the procedure. I employ medical physicians and nurse practitioners who are experts in the injections. But I'm the one that goes out and does the talks and answers the questions. I partake in the consultation and exam. But why would these people come to me instead of the orthopedic surgeon? Well, the orthopedic surgeon, the way I see it, is people go in, they get their treatment, and then they're like, good luck. I hope it works,
Right.
We are going to follow up. In fact, we include follow-ups, 6 to 8 follow-ups after our procedure, and we use everything in our office at no additional charge. If you pay for the stem cell therapy, we offer the laser lights, the spinal decompression, exercises, stretching. I'm drawing a blank, but we got $500,000 of equipment here that we also use to get that person the best result possible. And after 8 to 12 weeks, we're going to see where that person's at. And I'm the only person I know that does this. If I need to boost those stem cells with more growth factors, we also do ozone, which your body needs oxygen to heal. So if we add ozone or maybe even more stem cells, we do that oftentimes at no additional charge, depending on the situation. So when somebody's investing in me, I don't have, like the orthopedic surgeon, if it doesn't work, they'll do surgery, no big deal. Me, all I have is the result. All I have for my reputation is to help these people. So that's what my 100% intention is. And even if it doesn't work out, I do not give up. We've done 54 neuropathies with our regenerative medicine, and 51 have had great results. I am not giving up on those other 3.
Right.
I just invested in more equipment, to see what we can do above and beyond what we've already done. So that's the difference is, not that I'm anything special, but I believe nobody cares. Nobody cares like I do. I'm going to go above and beyond the typical orthopedic surgeon who's probably, he loves doing his surgeries. Of course, he got into medicine to help people, but I don't have surgery to fall back on. I have to help you with something natural, and that's what I fully intend to do, and that works out about 95, 96% of the time.
Wow. So what are the main surrounding areas where you live right now where people can find you, or that you service, that you notice that you service around your surrounding areas?
I'm sorry, what was the question?
Yeah. What are the main surrounding areas that you're covering right now that you see people maybe even coming from to come see you, and also your surrounding area that we want to get more information to contact you, call you? Because after this, we're going to have a lot of your testimonials that people are going to see after this. So they'll see live testimonials of people you've changed their lives. But I know that there's going to be a lot of people in your surrounding areas that are going to want to call a phone number that's on the screen right now and also look at your website. So how would people find
my,
you?
my area is Naples. We have surrounding Bonita Springs and Marble Island and Fort Myers. And our website is feelamazing.com. We have a couple more websites coming out up just for the regenerative medicine and just for the neuropathy, because sometimes there's too much distractions on one website for somebody who
Which one do I take?
But anyway, our phone number is pretty easy, 239-330-1000, 330-1000. But on our website, I think in January, it's, we have something here called season. When all the snowbirds come down, our population at least doubles, maybe triples. And I'm actually doing more than 30 seminars in January for neuropathy and for regenerative medicine. So, and some of these seminars, we do them at the library, and others, we actually buy dinner and breakfast at Perkins. It's not going to be Capitol Grill, but I will feed you and educate you and teach you what all the difference is and answer all the questions on what this regenerative medicine is, because it is very confusing. I have people say, yeah, I'm going to go do it here because it's only $500. I'm like, that's impossible. I said, well, what are they going to do? And they said, I don't know. Well, of course you don't know. It's very confusing. So, yeah, there's a lot of people in town doing different things, but I will try to sort out the confusion for anybody who wants to either just give me the call, I'll talk to them free over the phone, or attend one of our seminars.
Okay, awesome. So that's great. Hey, everyone, here's the thing. Dr. Hiler, he has seminars every month. We have the phone number on the screen. We also have his website on the screen. And here's the great thing. Right after this, we're going to have live testimonials of people that he's helped change their lives forever. So if you're in pain right now, you're even doubting, you're on the fence, let me tell you something. Stop doubting. Get that in your head and just flick it away. Stop doubting. Call Dr. Hiler. And everyone, share this. Sharing is caring. And Dr. Hiler, I want to say thank you so much for being on the show. I know that we're going to have you on again because I want to talk more about some other great niches that's going to be coming up soon. But I just want to say thank you so much. And thank you for all the work that you do in helping people get better.
I am a competitive ballroom dancer. My lifestyle was becoming impossible. I could not do what I do. It was affecting my day-to-day life, but more importantly, it was affecting my ballroom dancing. So I had stem cell about 9 months ago, and I have no pain anymore. I feel really good. I can live my life again, and I can do what I love to do. I feel amazing.
I came into Dr. Hiler's office here about 4 months ago. When I came through the door, I could barely walk. I had a bulging disc in my lower back. At that time, I was pretty scared because of what the pain I was in. Through spinal decompression and his adjustments, within a week, I was back to being able to walk again. And being an avid tennis player, shortly thereafter, I was back on the courts playing again. I feel amazing.